You're all welcome to Sir Spandan TCM Academy. Today our topic is headache. So most of people are suffering from headache. So they are visiting many doctors. They are making many reports, many files. They are carrying many files to doctors. But they are not getting rid of this headache. So no one doctors can stop their headache in some cases. So like the migraine headache, people carrying this migraine headache in full life. So there are many headaches, the vertex headaches, the occipital headaches, then the frontal headaches, the side of the head headaches. Okay, so let us discuss today. So how acupuncture can help to such type of headache. So am I visible? Am I audible? Am I visible? Am I audible? Please reply me on the chat box. Okay, thank you very much. Okay, so let us discuss the science, this acupuncture science, this is the TCM science. So how we can manage such types of headache. So let us understand some types of the headache. So as per TCM, so as per Chinese name of the meridian, so there are the 6 type of headache. It is the Taiyang type headache. It is the Yangming type headache. It is the Shaoyang type headache. And in Yin type, it is the Taiyin, Shaoyin, and Juin type. Mainly, there are the 6 type of headache as per TCM. So we need to work on this headache on 6 type. So see, location of headache behind the eyes. Location of headache behind the eye. This is also one of the headache. Okay, there is location of liver yang rising headache. So this type of headache is called liver yang rising. This is the location of the occipital and vertex headaches. And this location of the laser yang headache. Laser yang, that is the gallbladder and triple O. Then it is the frontal headache, this type of headache, frontal headache. It is the Yangming type headache. This is the occipital and vertex headaches. Okay. So let us discuss the generally headache. What is the headache? So headache is one of the most common presenting symptoms in most of patients. Chinese doctor differentiate first all between headaches of internal origin and those of external origin. Only two types of headache in they differentiate. Chinese doctor differentiate two types of headache. Those who headache internal origin and those of external origin. When asking a patient about headache, so it is important to ask systematically about onset. So when, what time, so onset of the headache, the time of the headache, location of the headache, and character of pain and aggravating factors. Okay, you should ask the patient, so you should take the history. Okay, onset of headache, it is the dull or intense. Time of headache, what time headache is occurring. Location of headache, it is the frontal headache, it is the vertex headache, it is the occipital headaches. Okay, or it is the side of the headaches. And character of pain and aggravating factors. So, headache, style and symptoms. So let us discuss the headache of internal origin. There are the two types of headache. One type of the internal origin and one type of the external origin. Okay. In headache of internal origin, it is very important to differentiate between those deriving from the fullness and those deriving from the emptiness. Again, there are the two types. Internal origin. One is coming from the fullness and one coming from the emptiness. The most common headache from the fullness include, if there is the fullness headache, it includes the liver young rising, liver fire, pain, blood stresses, liver vein, stomach heat, and retention of the food. These all causes are referring to fullness symptoms. Okay. And the most common headache from the emptiness. Emptiness including the blood deficiency. Blood deficiency is the emptiness. Blood deficiency, stomach and skin deficiency, and kidney deficiency. These are the three factors which cause headache from the emptiness. Okay? Blood deficiency, stomach and skin deficiency, and kidney deficiency. These three factors cause the emptiness of type of headache. Now onset. So how headache start? A recent onset and short duration. If headaches recent, immediate, instant onset and start, short duration. Short duration indicate headache from the exterior invasion of the wind. So it is the external invasion of the wind, external attack of the wind. If headache comes instant and for a short duration. A gradual onset with the long duration. If headaches come gradually, slowly, headaches come slowly and with long duration, full day, or 1 day, 2 days, 3 days, 15 days, 1 month, 2 months. Okay? So a gradual onset with the long duration indicates headache from the interior causes. One of the external causes, that the short duration and the instant headache, and one from the longer duration. Okay, so long duration and gradually onset. That is from the interior causes. Now time. Headache occurring in daytime. If headache, someone suffering headache for daytime usually indicate it is a Qi or Yang deficiency. If headache come in the daytime, it is indicated Qi and Yang deficiency. And headache comes in the evening, maybe due to blood or yin deficiency. Evening headache is because of blood and yin deficiency. And headache is starting at night during sleep. If headache is coming at night when you are going to bed, it indicates the blood stasis. The blood is not moving freely in your body. So it is the blood stasis. Now location. So at the occiput headache, back of the head, headache on the back side, occiput headache, it is the greater yang channel. This is the small intestine and urinary bladder. This is the greater yang channel. Can be from exterior invasion of the vein. And if the pain is severe or from interior, it is kidney deficiency if the pain is dull. If dull pain on the occipital headache, that of the side of the, it is because of kidney deficiency. And if headaches come on the forehead, it is the bright yang channel, stomach and large intestine. Can be from stomach heat or blood deficiency. If any patient suffering from the stomach heat or blood deficiency, so we can identify by observing the patient's tongue. Okay, forehead headache. Forehead headache, bright yang channels, stomach and large intestine. Can be from stomach heat or blood deficiency. And temple and side of the headache. Temple and side of the headache, it is a laser yang. Laser yang is gallbladder and triple-normal. This gallbladder and triple, this is the pathway of the gallbladder and triple-normal. Okay, so we are telling that the laser yang headache. Okay, temple and side of the headache, it is the laser yang. That headache on laser yang meridian pathway, gallbladder and triple hormone can be from exterior vein in the laser yang or from your yang rising. It is because of your yang rising or exterior vein, both, that is the interior and exterior also. Your yang rising is the interior region and the exterior wind from the exterior region. And if headache suffering, someone suffering from headache on the vertex area, or top of the head, vertex area, it is the terminal in channel. So which are the terminal in meridians? It is liver and pericardium. Terminally. And it is usually from deficiency of liver blood. If liver blood is deficient, then these headaches will be happen on the headaches on the vertex. And whole head, headache on whole head. पूरा सर में अगर हेडेक रहेगा, headache on the whole head, it is the anterior invasion of vein heat. Anterior invasion of the vein heat or kidney deficiency. It is because of anterior invasion of the vein heat and the kidney deficiency. And one more, temple side of head and eye. This type of headache is because of laser yang channel. So laser yang channel. Which is the laser yang channel? Is the gallbladder and triple organ. It is usually from the liver yang rising. If liver is hyperactive, liver yang rising. So this headache is occurring temple side of the head and behind the eye. Now let us discuss the protocol for liver yang rising. Liver yang rising. So there are the 10-point protocol. 10-point protocol you can write down or no need to write. I will share the PDF after this session. No need to write. Okay, liver yang rising. So liver 3, triple armor 5, GB43, GB38, bladder 2, and Taiyang, it is the extra point, and GB20, GB6, GB8, GB9, these all points on the head. Okay, and all points should be seated. Why? Because we need to subdue the liver yang. We need to sedate the liver yang. And other spleen 6, kidney 3, and liver 8. This all point tonification or to tonify the liver in. Because there is the liver indeficiency. So liver yang is rising. If there is an indeficiency, yang will be rise. There is a yang deficiency, in will be rise. Okay, we need to sedate the yang So we need to increase the in. So we need to increase 25 the in. If headache behind the eye, it is on the liver channel. Liver channel is the responsible. Either it is liver young rising or liver blood deficiency. If headache on behind the eyes. Now, characters of the pain. Dull act. If headache is the dull, usually indicate deficiency, while an intense and sharp pain usually indicate the excess. If pain is excess, there is a pain is intense and sharp. It usually indicate the excess. A hurting and expanding pain. If pain is hurting and expanding, so that indicates the liver young rising. This pain is liver young type. A pulling pain, indicating liver wind. Pulling pain is indicating liver in. Sorry, indicating is pulling pain is indicating liver wind, and fixed and boring pain. There is a fixed pain on the vertex pain or occipital pain or the side of the head pain. So when there is a fixed and boring pain, this indicates the blood stasis. A dull pain, dull up with the head feeling as if we are wrapped in full of cotton wool. If someone wrapped my head, and sensation of heaviness in the head, that indicate the dampness of or flame. It is the heaviness in the head and feeling someone wrap whole head. So it is indicate dampness and flame. If headache that experience inside the head is usually due to kidney deficiency. If headache is inside the head, it is not external, internal. For internal headache, it is because of kidney deficiency, kidney indeficiency. So if headaches come from the liver blood deficiency, so there are the points. So we can use this point, pericardium 6, SP6, SP10, liver 8, CV4, ST36, UB17, UB18, UB20, and UB23. This 10 points protocol for liver blood deficiency. So nowadays, there is always most of patients who comes in your clinic by liver blood deficiency. So all points are tonification and all points are bilateral. And use moxibustion, moxa, on every point. Give moxa on every point, particularly back point and ST36, CV4, CV4, ST36, UB17, UB18, UB20, and UB23. Give moxa so that the blood deficiency will be recovered in the liver. Liver capacity to store the blood, it is the 1.5 liter. If there is a less than the 1.5 liter, so liver is suffering blood deficiency. Understand? If headaches come from the kidney insufficiency, if headaches come from the kidney insufficiency, the points are kidney 3, kidney 6, kidney 9, kidney 10, SP6, REN 1, and REN 4. All points are production and all points are bilateral. If you want to increase the blood, so bladder 17, bladder 18, bladder 20, and bladder 23. This point I discussed this. Okay, and liver 8, SP6, ST36, and CV4. And one special point for headache is for frontal headache. Okay, apply the UAO, it is the extra point. So the middle of the eyebrow, UAO point. So I will, I shared that picture. Okay, how to locate the UAO point. I shared in the PDF. Okay. If heart blood deficiency, headache from the heart blood deficiency, what is the heart 7, pericardium 6, CV14, and CV15. CV14 and CV15. REN 14 and REN 15. This all points contribution. And next, the how headache aggravating factors. Chronic headache that improve by rest. एक chronic headache बहुत पुराना हेडेक है और सोने के बाद वो इंप्रूव होता है are due to deficiency. There is the deficiency. It is the Chi deficiency. It is the blood deficiency. Okay, it is the body fluid deficiency. And if they are improved by exercise, means walking, running, standing, okay, or any work doing. If they are improved by exercise, they are due to your iron. Flame or blood stress. It is full condition. Headache. And headache aggravated by lying down. If patient is lying down, and that time headache aggravated, it is usually indicated of fullness, liver rank rising, liver fire, flame, and blood stress. And if that patient aggravated by lying down, headache is lying down, they usually indicate the deficiency. Next, headache that are improved by eating its headache increase by 80, usually indicate the deficiency. So, if they are aggravated by eating, so indicate excess. And especially flame or retention of food. Differentiation of headache is best done by distinguishing headache, interior origin or from those of exterior origin. The headache from your young rising. Headache from your young rising. Headache from your young rising manifest with a throbbing pain. Just a minute. So, headache from your young rising manifest with the throbbing pain. Throbbing pain, usually unilateral, so often moving from side to side, whether it is the right side or left side. It is moving side to side and located behind the eyes on or on the temples or on the lateral side of the head along the gallbladder channel. It is because of liver young rising. This is the manifestation of the liver young rising headache. If it often comes from nausea, feeling of vomiting, it often comes with by nausea and vomiting and dizziness, fainting, and blur vision, flashing light, and wiry pulse. This is the liver young rising manifestation. The headache from liver fire. This is a second type. The headache from liver fire, which less common, is similar in character to that from liver young rising, but it is come with liver fire symptoms and signs such as the intense thirst. That there is the fire, so it is they are consuming the fluid. So patients feel the intense thirst and bitter taste in the mouth. The fire, fire taste is the fire element taste is the bitter. And it is there, so bitter taste in the mouth, red face, red complexion, and dark urine and dry stool. This is the manifestation of the liver fire. Okay, your fire. Now, another very common type of headache. Very common type of headache is from flame obstructing the clear orifice of the head. In this case, the headache is dull when flame obstructing the clear orifice of the head. In this case, the headache is dull and the head feels as if it's wrapped in or full of cotton wool with the pronounced feeling of heaviness. Phlegm, phlegm means heaviness and muciness and blurred vision and other manifestations including the feeling of nausea, a feeling of oppression in the chest भरा हुआ लगेगा, a swollen tongue. If you observe the patient tongue will be swollen and slippery pulse. Although, in my experience, one of the most common type of internal chronic headache is that derived from a combination of the liver yang rising and flame. So this is the most common reason, this because of liver yang rising and flame. With the flame being carried upward by the ascending of liver yang. Flame is pushing the liver yang rising. Headache from blood stasis. If blood stasis is there, is characterized by the intense fixed boring pain, usually unilateral and go with by purple tongue and wiry pulse. If blood stasis is there in anywhere in the body, blood stasis. So if you see the patient tongue will be purple. And pulse will be wiry. Okay, let us learn the first diagnosis in next month or other month. Okay, I will teach how to diagnose the pulse and tongue diagnosis also. And a very chronic, long-standing case of headache, the blood stasis type of pain often may be combined with the other types. The chronic repetition of the headache in the some part of the head may itself cause local blood stasis. So, for example, in the patient suffering from liver yang type of headache, if patient suffering from liver yang type of headache for many years, occurring always on the right side, this may by itself cause a local stasis of blood in the head or that side, and so that headache will manifest with the symptoms of both liver rising and blood stasis. Okay. Now, how to manage, how to resolve the liver blood stasis? So, points are protocol, GB34, liver 3, liver 5, liver 6, bladder 17, bladder 18, CV6, and ST9. And treat Chongmai. Chongmai. It is an extraordinary vessels. It is the Chongmai vessel. If for blood stasis in the uterus. So it is the painful uterus, that is cramp, that is the cramps in abdominals and cramps in the thighs when menstruation starts. This because of blood stasis in the uterus. Okay. Then treat Chong Mai. These are SP4 and pericardium 6. SP4 on the right side and pericardium 6 is the left side. And other 2 points are the kidney 14 and SP10. Kidney 14 and SP10. Total protocol to treat Chiang Mai, it is the SP4, pericardium 6, kidney 14 and SP10. And our famous protocol for the headache because of kidney cyst, liver cyst stagnation. Headache is because of liver cyst stagnation. It is the triple number 6, liver 3, liver 13, liver 14, GB 34, and pericardium 6. So you need to apply this point on the dual meridian. Okay, I will share the dual meridian chart in the group. Okay, so all points should be sedation. This protocol on the liver cyst stagnation, all points should be sedation and all points are bilateral on the both sides. If headache from liver vein, it's come by a pulling pain and with by severe dizziness and tremors. So the headache from stomach heat is the characterized by intense pain and it is comes with the epigastric pain, sore belching, and yellow tongue coating if there is the stomach heat. Sore belching, epigastric pain, and tongue coating will be yellow. The headache from retention of food. If food is retention, if food is not getting digestion and food is retention, retented in the stomach, food retention in the stomach. If there is a food retention in the stomach, it's come by a diffuse and intense pain on the forehead and along with the nausea, feeling of vomiting, sore belching, feeling of fullness of the epigastrium, and tongue will be thick and sticky coating and slippery pulse. Headache from blood deficiency. If headache, someone suffering headache from the blood deficiency, usually of the liver and heart is considered by a dull act. If there is a dull act, that liver and heart meridians are involved. Usually on top of the head and is with by dizziness, fainting, so blur vision, insomnia, palpitation in the chest, and tongue will be pale. Headache from stomach and spleen chi deficiency. If headache on the stomach headache from the stomach and spleen Chi deficiency. Stomach Chi and spleen Chi are deficient, considered by dull frontal headache and with by tiredness. Patient will be tiredness, laziness. Okay, patient को आलस रहेगा, laziness, lassitude. Okay, weak limb, leg and hands will be weak, and diarrhea, loose stool, poor appetite, and pale tongue. It's headache because of stomach and spleen deficiency. This is the symptom. So headache from kidney deficiency. If kidney is deficient, kidney indeficiency, headache from the kidney deficiency, which will be in or yang deficiency, is characterized by dull headache all over the head and with bad feeling of emptiness of the head and dizziness and tinnitus. That is the sound in the ears. Okay, why sound in the ear? Kidney opens to ear. Now let us discuss headache of internal origin. Sorry, headache on external origin. External headache are because of the attack of wind cold, wind heat, or wind dampness, wind cold, wind heat, and wind dampness. And they all obviously have an acute onset. When headache of external origin, headache will be acute onset. Instantly headache. Okay, it is not gradual. The headache from wind cold is considered by a severe occipital headache and stiffness, and together with the pronounced aversion to cold, and patient will suffering with the fever and sneezing. So what is the protocol? Expel wind. We need to reduce the wind, expel wind by LU7. Okay, treat LU7 and dry cupping and moxa on bladder 12 and LU16. This is because of occipital type headache. And headache from wind heat. If headache from the wind heat is considered by a severe pain as if the headache were being cracked open and is go together with by the aversion of cold, fever, sore throat, and slight sweating. And protocol, expel wind by acupuncture point, LU7, Li4 is the LU7 is the Leo connecting point, and Li4 is the source point. And tapping on bladder 12 and GB20 and Li11, LU11, BU14, triple warmer 5 and DU16. To these points is clear heat in case of occipital headache. If headache from wind dampness is considered by a dull headache, as if the headache were propped up and it go along with the feeling of heaviness of the head. So aversion to cold, fever, slight sweating, and nausea. This is the wind dampness. And protocol, treatment principle, resolve, blame. And acupuncture points, LU5, ST40. It is the master point. ST40 is the master point for the resolve blame. And CV12, bladder 20, CV9 to regulate water metabolism. So why there is the dampness and the flame? It is because of there is the stagnation of the water. So water metabolism is not proper. So this point is caused to regulate the water metabolism. And second treatment principle is the descending lung chi. So LU1, LU5, LU7, CV22, bladder 13 is point to descend the lung chi. And open chest, we have to open the chest. CV17, it is the insertion point for the chi. And pericardium 6, it is the distal point of the chest. Pericardium 6. Now let's discuss the type of the headache. Type of the headache and patterns. If there is the throbbing headache, it is because of liver yang rising. Just meter. In throbbing headache, if there is the throbbing headache, always it is because of liver yang rising. And dull headache with feeling of heaviness. Dull headache with the feeling of heaviness, it is because of dampness. Dull headache with feeling of heaviness and dizziness with the painting. It is because of flame. And starting boring headache. If there is the headache, stabbing and boring, it is because of blood stasis. And headache with the pulling pain. Headache with the pulling pain, it is because of liver vein. and headache with the intense frontal headache. Intense frontal headache. It is the stomach heat and severe dull frontal headache. Severe or dull frontal headache, it is the retention of food. Dull headache on vertex. With dull headaches on vertex, it is because of blood deficiency. Mild dull frontal headache. Frontal headache, it is the mild or dull, it is the stomach deficiency. Headache with feeling of emptiness of head. It is because of kidney deficiency. And acute headache with occipital stiffness. It is the external wind cold and acute severe headache. Acute severe headache, it is because of external wind heat. Acute severe dull headache, it is because of external dampness and recent onset and short duration. Recent onset and short duration, it is the external headache. And gradual onset and long duration, it is because of internal headache. Headache in daytime. So I categorize these headaches. So headache in daytime, it is the Qi or Yang deficiency. Headache in evening, it is because of blood or yin deficiency. And headache starting at night. If headache starting at night when you going for sleep, it is because of blood stasis. And occipital headache. Headache on occiput is the kidney deficiency or external wind cold. Frontal headache, it is because of stomach channel. And headache on temple and side of the head, it is because of, it is on gallbladder channel. Headache behind the eye, liver channel. Headache on vertex, it is also liver channel. Headache on whole head, it is because of external wind or kidney deficiency. And headache aggravated by lying down. Headache increased headaches aggravated by lying down. It is the fullness. And headache improved by lying down. It is the deficiency. If headache improved by the lying down, it is the deficiency. Headache better after eating. You eat something, headache will be better. That is the deficient type. And headache worse after eating. When you eat, then headache start, headache worse. It is the excess type. Now, let us discuss the protocol on headaches types. So don't write down this protocol. Every protocol I given in the PDF. So I will share the PDF with you in the group. So don't write, only listen. So throbbing headache is the liver young rising. So nourish the liver. There is a liver 8, SP6, ST36, kidney 3, kidney 6, and bladder 2, GB6, GB8, GB9, GB20, and GB38, and GB43. So calm mind and subdue yang. So this point for calming the mind and subdue yang is the liver 3, LI4, triple hormone 5, and pericardium 6. Now, second, dull headache with the feeling of heaviness. It is because of dampness. So we can treat this dampness on the 3 burner: upper burner, middle burner, and lower burner. So we can observe this dampness by the tongue position. Okay, whether upper burner is affected, whether the middle burner is affected, whether the lower burner is affected. If upper burner is affected, this DU16, RAN 17, LU7, LI4, LI6, 0004, and 0006. If middle burner is affected, RAN 9, RAN 12, RAN ST22, and RAN 11. And if lower burner is affected, ST22, RAN 5, bladder 22, bladder 39, SP9, SP6, kidney 7, 0004, and UB64. If dull headache with feeling of heaviness and dizziness, it is because of phlegm. When there is the dizziness, you focus on phlegm. Here is also 3 burner, upper burner, flame is the DU26, RAN 17, LU7, LI4, LI6, 0004, and 0006. And bladder and middle burner, RAN 9, RAN 12, ST22, and RAN 11. And lower burner, ST28, RAN 5, bladder 22, bladder 39, SP9, SP6, kidney 7, 0004, and bladder 64. Then stabbing, boring headache. Stabbing, boring headache. It is because of blood stasis. So protocol is to resolve the blood stasis, bladder 17, GB34, pericardium 6, SP4, and SP10. So all points should be sedation, and all points are bilateral. Headache with the pulling pain, it is because of liver vein. Points are UB18, GB20, DU16, DU20, kidney 6, liver 3, SP6. All points are sedation, and all points are bilateral. intense mental headache. It is the stomach heat. Kidney 2, kidney 3, SP3, ST21, ST40, ST44, and ST45. All points are sedation and all points are bilateral. Severe dull mental headache. Severe pain or dull pain in the frontal head. It is because of retention of food. Bladder 20, bladder 21, CV10, SP4, SP6, ST36, and ST44. So all points are tonification, all points are bilateral. And dull headache on the vertex, it is the blood deficiency. So points are UB17, UB20, kidney 1, SP6, SP10, liver 8, and ST36. All points from tonification, all points are bilateral. And middle dull frontal headache, stomach deficiency. Okay, so bladder 20, kidney 2, kidney 3, SP6, and ST36. All point tonification and all bilateral. Headache with the feeling of emptiness of head. Feeling of emptiness of head with the headache. It is the kidney deficiency. CV4, kidney 1, kidney 3, kidney 6, kidney 9, and LU4, LU7. All points tonification and all points are bilateral. Acute headache with the occipital stiffness. It is because of external wind pull. Okay, so treatment principle, expel wind, this is the LU7, and cup and moxa on bladder 12 and bladder 6 and GB16 for occipital headache. All points are bilateral. Acute severe headache, external wind hit. Expel wind, LU7, LI4, and cupping on bladder 12 and bladder and GB20 to clear heat. All points are bilateral. Acute severe dull headache. Acute severe or dull headache, it is the external dampness. ST40, SP9, bladder 20, and bladder 21. All points sedate, all points are bilateral. And headache in daytime, if headache suffering, patient is suffering headache with the daytime, kidney or yang deficiency. Sorry, Qi or yang deficiency. First, Qi deficiency, bladder 20, CV6, kidney 7, LU9, and ST36. And yang deficiency, bladder 23, bladder 62, CV6, kidney 7, and SI3. All points are tonification, all points are bilateral. And headache in evening, blood or indeficiency. So indeficiency headache, CV4, heart 6, and kidney 6, and LU7. All points are tonification, all points are bilateral. And blood deficiency, bladder 17, kidney 1, SP6, and SP10. So all points are tonification, all points are bilateral. Headache starting at night when you are going to sleep, headache stop. So it is the blood stasis. Bladder 17, GB34, pericardium 6, SP4 and SP10. All points are sedation, all points are bilateral. And occipital headache, kidney deficiency or external wind cold. Kidney insufficiency protocol, CV4, kidney 1, kidney 6, kidney 9, LU7, and all 25. And external wind cold, bladder 12, GB20, GB31, GB34, liver 3, and triple armor 5. All points are 25. And all points are bilateral. And frontal headache, it is because of stomach channel. Here we are using the global balance. So right hand, liver 3, LI11. If frontal headache, because of stomach channel. Okay, right hand, liver 3, LI3 and LI11. Left hand, LU9 and LU5. Left leg, ST43 and ST36. And right leg, SP3 and SP9. Headache on temple and side of the head. It is the gallbladder channel. So points are right hand, triple over 3 and triple over 10. Left hand, heart 7 and heart 3. Left leg, GB41 and GB34. And right leg, kidney 3 and kidney 10. If headache behind the eyes, it is liver channel. It is the joint. Okay. Points are right hand, pericardium 7 and pericardium 3. Left hand, TW3 and TW10. Left leg, liver 3, liver 8. And right leg, GB41 and GB34. Headache on vertex. It is also liver channel and this same protocol. Like headache behind the eyes. The headache on whole head. It is because of kidney deficiency. Points are CV4, kidney 1, kidney 6, kidney 9, elusive. All points tonification and bilateral. Headache on whole head. External wind or kidney deficiency. External wind, 25, depends which. So points are right hand, LI3, LI11, left hand, LU9, LU5, left leg, ST43, ST36, and right leg, SP3 and SP9. And if headache because of internal wind, so tonify liver blood. So we need to apply the liver blood deficiency protocol, pericardium 6, SP6, SP10, liver 8, CA4, ST36, bladder 17, bladder 18, bladder 20, and bladder 23. All points tonification and all points bilateral. So again, I'm telling you, headaches are two types. One is the external type, and one is the internal. Again, external types divided into two types. Wind headache, wind headaches come from only wind, and headaches come from wind dampness, external headache. And again, wind, wind heat, and wind cool. Okay. Again, there is the internal headache. Internal headache is the empty and full, fullness and emptiness. Emptiness headache is because, again, there are the three types of the emptiness headache. Okay, emptiness headache is because of deficiency and because of blood deficiency and because of kidney deficiency. It is and because of Chi deficiency. And full headache, fullness, internal headache, because of fullness, there are the many factors. It is the liver yang rising, liver fire, liver weak, liver chi stagnation, and stagnation of food in the liver channel, and dampness, flame, twin flame, retention of food, and blood stresses and stomach heat. It is of the internal fullness patterns. Okay, so everything I shared in the PDF, we'll get the PDF. Now let us discuss the case histories that patients I treated in my clinical practice. I share the case history. So one of the 14 years old girl had suffered from the recurring headaches. Headaches comes again and again. Recurring headaches since age of 10. Okay. The headaches were severe and comes approximately every 3 months. The headache are concentrated in the area behind the eyes. And it was throbbing in character and also by with the blur vision, vomiting, and what she describes me, the unclear vision apart from the attack of severe headache every 3 months. Okay, severe headaches comes in every 3 months. She also experienced frequently dull headache in between severe headache. I asked some question to her, and she said she suffered from chronic tiredness and experienced some tingling in her limb. Limb was tingling. Her tongue was pale and slightly swollen and had a sticky foot. So how I diagnosed the headache are very clearly is your young type, which is confirmed by the throbbing character of the pain. When there is the throbbing character, there is the liver young rise. Always understand. The location behind the eyes and the omitting. Earlier, there are two other patterns which are evidenced by very few symptoms. First of all, there is some liver blood deficiency, which is indicated by the chronic tiredness, the pale tongue, and the tingling in the limb. Liver blood deficiency is obviously the cause of the rising of liver young. Liver young rising is the manifestation, but root is the liver blood deficiency. Throbbing means intense headache. Intense headache. This some is cutting. Throbbing. Throbbing is the intense headache. And second, there is also some flame. This is evidenced mostly by the tongue being swollen. If tongue is swollen, understand there is the flame. And there is the white sticky coating. The unclear eyes will also be interpreted as a sign of flame obstructing the eye orifice. There is the no luster. It is the dull eye. It is because of flame. This is the good example of the importance of the tongue as indication of the certain pattern, even in the absence of symptoms. For this reason, the tongue should never be ignored. So always try to see the tongue. You should learn the tongue diagnosis. It is very important tool to diagnose the patterns. So tongue should be never be ignored when they do not appear with the presenting symptoms. For example, in this case, if liver blood deficiency with the liver young rise, liver blood deficiency is the root and manifestation is the liver young rise. So we need to pollen and sticky coating is indicating the flame. So, for example, in this case, liver blood deficiency with liver young rising, the tongue should have been pale and thin. Liver blood deficiency, tongue is pale and thin. Liver young rising, tongue is thin. So why should the tongue show a certain patterns and the patient not show any sign? Why it is? So this is often happen in young people when there is a certain pathogenic factors. In this case, it is the flame. But due to young age of person, it has not given rise a clinical manifestation yet. Tongue is showing, but clinical manifestation is not comes yet. The treatment principle in this case should therefore be not only to nourish the liver blood and subdue the liver yak, but also resolve the flame. We should also resolve the flame because tongue is something swollen, little swollen. Now, case history 2. A 20 years old woman had been suffering from migraine since the age of 30. She was thin and was quite tall and thin and tall and was always fast, walking fast. Her body shape was a typical wood type. She was thin, always walking fast. So body type was body typical wood type. Her complexion was dull and shallow. Her hair was dry and her eyes has good sheen. Eyes have good sheen. Eyes are lustrous. The headache were of the character, throbbing character, and always appear on the left side of the head along the gallbladder channel and behind left eye. Headache occur weekly and nearly always together with by nausea, but vomiting and photophobia. Double vision. The headache was not affected by posture or food intake, and although a headache always occurred with her period, she also suffered from headache at other times. So headache were aggravated by damp and windy weather and also by stress and fatigue. So striking features of the headache was that they were markedly better during two pregnancy. So and worse after worse soon after childbirth, both time. When she was pregnant, headache was quite, and start again after childbirth, both time. She had two children, one 3 years old and one 6 month old. So in advanced scan, discovered no abnormal sound sign, and drugs for migraine produced and worsening. When she taken the medicine, tablet, or any therapy, so headache was more intense. The period were quite normal, coming regularly and with normal amount and color, but rather painful on first 2 days. Her general health was good and no abnormal in urination or defecation or sleep. Her tongue was very slightly pale, but red on the side, swollen with the sticky coating, and there was a small peeled patch on the left side on the breast area. So you should take the patient history like this. So don't start the needling when patients come on the table. You should ask the question. You should take history about the patterns, about the lifestyle, eating habits, sleeping patterns. So what I diagnosis in this case, in this lady? So observation of her body type indicate that she is wood type. Her fast walk is the evidence of this, which is the good sign. Each 5-element body type has a characteristic walk and abnormal from this is not a good sign. If there is the abnormality, if wood type person walking slowly, it is the abnormal sign, and it is not a good sign. For example, a wood type should walk in fast way, and if they walk stiffly, it would not a good sign. Her dull complexion and dry hair suggest deficiency. Dull complexion and dry hair, it is the deficiency. The normal sparkle of her eye suggests that she not suffer from any deep emotional problem. If someone patients suffering from any stress, emotional trauma, some fighting issue in the home, so uh, eyes will be not sparkle. Eyes will be not luster. Okay. So the marked improvement during pregnancy, marked improvement in her headache during pregnancy and aggravating after childbirth it strongly suggests a deficiency of the kidney and the disharmony of the penetrating and directing vessels. It is this among the 8 extra meridian, penetrating, Chongmai and Duimai. This is confirmed also by the onset of the headache soon after the menarche. Menarche is the first menstruation, which occurred when she was 12 and half years. So I therefore need to confirm the presence of blood deficiency and kidney deficiency with further questions. I asked her many questions. To confirm or ignore blood deficiency, I asked about the numbness and tingling of the limbs. If there is the blood deficiency, always numbness and tingling of the limbs. There will be dizziness, there will be poor memory, there will be insomnia, lack of sleep, and blur vision. She did suffer from tingling of her limb, but from none of other symptoms. Only tingling was there. Though I can conclude that there is some blood deficiency from the tingling of her limb. I can conclude it. Tingling of limb, it is a blood deficiency. The dull complexion and the dry hair. Okay. As for the kidney deficiency, she had no symptoms of it apart from lower back ache. And these symptoms together with the onset of the headache and the menarche. The improvement during pregnancy and worsening of after childbirth confirm the presence of kidney deficiency and the harmony of the disharmony of the penetrating and directing vessels, Chongmai and Yumai vessels. Pale color, pale color of tongue and weakness and weakness, pale color of tongue and weakness, confirmation, blood deficiency, and kidney deficiency. However, the swelling of tongue, body, and sticky protein indicate the flame, something that was not apparent from observation of or questioning. So, her thin body indicates a tendency of blood or indeficiency, while flame usually manifest with the tendency of being overweight. Okay. Furthermore, she had no other symptoms of flame. There was no dizziness, no blur vision, no feeling of headache, no feeling of heaviness of head, and no dull headache, no spitting of flame. Okay. However, in this case, I never ignored tongue sign and concluded that she had no other symptoms of flame. So the tongue sign were clearly enough to confirm the presence of flame is confirmed by the aggravation of the headache in the damp weather. The simultaneous presence of liver yang rising and flame is very common cause of chronic headache. So the character of the headache indicates very clearly to liver yang rising, which is confirmed by throbbing nature of pain. The nausea and vomiting, the sensitivity to light, and the location of headache on the vulvar channel. So we can therefore conclude that the causes of rising of headache or rising of liver yang are the blood and kidney deficiency. The former constitute the manifestation and the latter the root from the pain is view of deficiency and excess. So the former consists of the blood deficiency and kidney deficiency and also skin deficiency while the lateral consists of liver yang rising, root and manifestation. So we can assume the presence of spleen Chi deficiency from the presence of plague. The pale color of her tongue. So see my observation. The pale color of her tongue body can attributed to any of her deficiency, that is blood, kidney, and spleen deficiency. When you observe the pale color of the tongue, it is always because of kidney, blood deficiency, kidney deficiency, and spleen deficiency. The redness of the side confirms the rising of liver yang, and the swelling of the tongue, body, and the sticky coating indicate this. The last part of the tongue to interpret is the peeled patch on the left side in what may under the certain circumstances be a breast area. There are two ways of interpreting the significance of this peeled patch. It could indicate either the very beginning of indeficiency, which may develop from blood deficiency or problem in the left breast, so that will be a problem in the left breast, such as the mastitis developed after childhood. However, the patient said that this was not the case. The other possible explanation is that the pill patch may indicate a more serious problem in the left breast, such as the malignant lump. So, in this case, we need to treat both the root and the manifestation simultaneously. So, the root by the nourishing the blood to define the spleen and kidney and strengthening the penetrating and directing vessel, and the manifestation by the subduing the liver yang and resolving plague. These are the manifestations. Liver yang rising and the plague. Now let us discuss the headache pattern differentiation. In case of full headache, full type of headache, it is the liver rising, liver yang rising. So signs are distending headache, which can be on the side of the head, on the gallbladder channel, on the temple, or behind the eyes, or dizziness, tinnitus, irritability, and propensity to outburst of anger. This is maybe a most common type of headache. Liver yang rising will arise from liver blood and liver indeficiency, or from kidney deficiency, and the clinical manifestation will be fluctuate consequently And acupuncture point, liver 3, GB20, equal 5, GB43, plus local point according to headache. And dampness obstructing the head. If there is the dampness that obstructing the head, say headache with the feeling of heaviness of the head, hair feeling as it wrapped in the cotton wool, a sticky taste, a feeling of heaviness of the hair and the body, epigastric fullness, a feeling of domination of the chest, excessive vaginal discharge, sticky tongue coating. And acupuncture point for this pattern, the dampness obstructing the head, it is the stomach 8, DU23, REN 12, REN 9, LI4, LU7, and DU20. Next, our turbid flame obstructing the head. Turbid flame. Turbid flame obstructing the head. The in case of pattern, there is the dull headache with the feeling of heaviness and muciness of the head. Poor memory and concentration. Dizziness, blur vision, sputum in the throat, a feeling of oppression in the chest, nausea, and swollen tongue with the sticky coating. Okay, acupuncture, ST40, REN 12, REN 9, REN 5, UB22, ST8, and DU20. Then liver young rising with the flame obstructing the head. Liver young rising with the combination of the flame that obstructing the head. Frequent, almost constant dull headache with the feeling of heaviness and dizziness of the head. So poor memory and concentration. Dizziness, blur vision, bottom in the throat and feeling of oppression in the chest, nausea, swollen tongue, and stick with the sticky coating. The frequent headache is the punctured by attacked by several severe distending headache, which can be on the side of the head, on the gallbladder channel, and on the temple or behind the eyes. There will be dizziness, tinnitus, irritability, propensity to outburst of anger. And acupuncture points is the liver 3, GB20, number 5, GB43, ST40, REN 12, REN 9, REN 5, UB22, ST8, and U20. And let us discuss the emptiness type. So emptiness type, first we discuss the blood deficiency. If headache because of blood deficiency, it is the dull headache on the forehead, or the vertex, dizziness, blur vision, poor memory, pale and thin tongue, and other symptoms and signs depend on the whether the liver or heart is affected. Acupuncture points are liver 8, ST36, SP6, RAN 4, and DU20. And liver vein, that is the pulling headache, tremors, sore dizziness, tinnitus, numbness of the limb, tics, stiff, divided, or moving tongue. Tongue will be stiff or divided or moving tongue. Liver stagnation. If liver stagnation is there, distending headache on the temple and or the forehead. Hypochondrial or epigastric distension, irritability, moodiness, a feeling of lump in the throat, then premenstrual tension, and blood stasis, stabbing, headache, fixed in the small area. Purple lips, lips will be purple, dark complexion, and purple tongue. Wind flame, so pulling headache with the feeling of heaviness of the head, sore dizziness, blur vision, tremors, numbness or tingling of the limb, nausea, sputum in the throat, a feeling of oppression in the chest, stiff or divided and swollen tongue. Liver fire, distending headache, which can be on the side of the head, on the gallbladder channel, on the temple or behind the eyes, red and blood shoot eyes. Your fire is there, it is the red and blood shoot. आंखें लाल लाल हो जाएगी उसकी. Red face, dizziness, tingling, tinnitus, irritability, and propensity to outburst the anger, thirst, bitter taste, and constipated person will be constipated, and dark urine, tongue red with the redder side, and dry yellow coating. Stomach ache, sore headache on the forehead, being epigastric pain, sore belching, nausea, excessive hunger, foul breath, a feeling of heat, red tongue with the yellow coating, and Chi deficiency, dull headache on the forehead that is aggravated by overwork and elevated by rest, and by lying down. Uncomfortable feeling in the epigastrium, no appetite, lack of taste, sensation, loose stool, tiredness, especially in the morning, weak limb, pale tongue. This is generally due to stomach Chi deficiency. And kidney deficiency, dull headache with the feeling of emptiness of the head, so aggravated by overexertion. Dizziness, lower backache, weak knees, tinnitus. Other clinical manifestation depend on whether this is a kidney in or kidney yang deficiency. And retention of food, headache on the forehead, that is the worst after eating. Fullness, pain, and distension of the epigastria that are the relieved by the vomiting. And other nausea, vomiting of sore throat and foul breath, sore belching, and insomnia, loose stool or constipation, poor appetite, and thick tongue coating. This type of headache is usually seen only in children. Invention of the wind cold, occipital headache, stiff neck, aversion of cold, fever, cough, itching, itchy throat, slight breathlessness, stuff or running nose with clear water discharge, sneezing, body ache, thin white tongue coating. And invention of wind heat, headache of whole head, aversion to cold, fever, cough, sore throat, stuffy or runny nose with the yellow discharge, headache, body ache, slight sweating, slight thirst, fallen tonsil, tongue is slightly red on the side. Then invention of the vein dampness, mental headache, feeling of heaviness of the head, aversion to cold, fever, epigastric fullness, body ache, tongue with the thin coating. Thin coating will be thin, sticky, and white. Apart from this, pattern identification according to internal organ, it is also important to, especially from the acupuncturist perspective, to differentiate headache according to the channel involved. So, headache on which meridian pathway you should observe. If greater yang channel, small intestine and urinary bladder. It is the occipital headache radiating at the back of the neck and the top of the back. It is acupuncture point SI3 and UB62. Bright yang channel, stomach and large intestine. Headache on the forehead, ST44 and LI4. Laser yang channel, triple hormone and GB41. Headache on the temple, the side of the head and the neck along the gallbladder channel and triple hormone channel. Points are triple hormone 4, triple hormone 5 and GB41. And greater in channel, it is the spleen and lung, better in mental headache. And acupuncture point, SP3 and LU7. Laser in channel, this kidney and heart. Chow in. Headache felt inside the head or on the occiput. Dull in nature. And points are kidney pore and heart fire. And terminal in channel, that is the juil, liver and pericardium. Headache on the vertex. Points are liver 3 and pericardium 6. Okay. So in my experience, the combination of liver yang rising and plague is the most common cause of chronic headache in adults. In women, liver yang rising causing chronic headaches usually arise from liver blood deficiency. Okay. Now let us discuss more headache protocol by using master tongue points. Any types of headache, any types of headache. It is the lingu and dabai. Use lingu and dabai. So I will share you the location of the point in the group, lingu and dabai. Okay, so this is the other technique. So how we can manage the headache? If we are patient come from the headache and telling you, doctor, can you treat my headache is occurring on the frontal side? So your answer will be yes. And use this point Li3 and ST8, UB60 and UB65 in tongue in between two eyebrow and REN 12. It is very effective point for the frontal headache. If headache is worsened, headache is aggravated by heat and pressure. So these are the tongue point, master tongue point. 77.08 and 77.09. or bleed 77.14. Okay, you can Google this point, you will get the location. This is the ST40 and 66.04. This is the liver 3. Okay, if the headache is increased by heat and pressure, it is the excess type. And if headache which feel better with warm and pressure, that is the deficient type. So for this headache, 77.18 and 77.17, this point you can use. It is very effective. And 66.10 and 66.11, it is the SP3 and SP4. Okay. So these are the point location which I discussed with you. So you can see in the recording, in the video, this location. Otherwise, you Google this point, you will get the location. If there is the migraine headache, so there are the meridians involved in the migraine headache: liver meridian, gallbladder, urinary bladder, stomach, triple. Okay, these meridians are involved in the migraine headache. And affected sick meridian are triple gallbladder, stomach, and liver meridians. So in case of migraine headache, you need to needle contralateral side, opposite side. If right side the migraine is there, the needle left side. If left is there, needle right side. So 88.25 and it is the GB31 and GB32. Treat all kinds of migraine headache. And you can add Dabai 22.04 and 22.05. Dabai and Lingo. And in case of headache on stomach and gallbladder meridian pathway, so ST36, that is, and 77.22, 77.23. So these 3 points you can needle. And 66.05 is the ST43 and 09 head, stomach, and gallbladder meridian. That headache in case of premenstrual headache. So if any female patients telling you when patient a period has to come, my headache is starting. So this point is very useful to manage her headache. 66.05 and 66.09. And if headache, migraine headache because of hypertension, high blood pressure, 66.12 it is a kidney 2 to treat migraine headache due to hypertension. And headache on pathway of the liver, stomach, and triple hormone meridian, always pericardium 6. Headache on bladder meridian, UB60, bladder 60. And guide point, local point for migraine headache is the GB4, GB5, GB20, and DU20. So needle has a same side on the headache. Okay, these are the points which I discussed with you. Then next, vertex headaches. If there is the vertex headache, top of the head, it is a very effective protocol. There is liver 3, kidney 1, and LI4. 3 points are enough. Liver 3, kidney 1, and LI4. So if headache on the DU meridian, 55.06, it is the kidney 1. So soul treat vertex. It is a soul and vertex. It is a mirror image as per Tan balance system. And bladder meridian, the headaches on the bladder meridian, UB60, UB65, UB67. Treat bilateral. And SI3 and 77.01 and 02 near bladder meridian. And LU7 and headache on liver meridian pathway. Okay, it is not a liver meridian not traveling on the head, but headaches if there is the vertex headache. So liver meridian, that is the other pathway of the liver meridians come here ending at the DU20. So liver 3, liver SI3, LU7, and pericardium 6 are the point. If Sancho, triple hormone meridian, kidney 1, okay, treat kidney 1. If the gallbladder meridian is affected, kidney 3, and guide point are the 1010.1, it is the DU20 point. Okay, these are the points which I discussed now. Then occipital headache. In occipital headache, it is the highly effective point. It is LI3 and LI4 and 66.04. It is liver 3, LI3, LI4 and liver 3 and kidney 1. Bladder 65 toward kidney 1. Needle bladder 65 toward kidney 1. And in case of brain tumor, meningitis, or sore occipital headache, so 55.06 kidney 1 and 77.01 and 77.02. So these 3 points should be needed. See, occipital headache on bladder meridian, it is a UB65, UB60, SI3, and UB67. And gallbladder meridian, GB20 and GB34. And guide point as a bladder 10. Okay, these are the points. You can Google this point for their exact location. And last is the whole head pain. अगर पूरा सर दुख रहा है, whole head pain, so all meridians are affected. Sensu, gallbladder, triple hormone, gallbladder, urinary bladder, and stomach and large intestine. If triple hormone meridian is affected, HJ2, then A.04, Sanchasan, that is the HJ2. Then 22.06, Zhongbai, it is the HJ3, triple 3, Zhongbai. And gallbladder meridian affected, GB20, 77.22, and 77.23. Bladder meridian, if bladder meridian affected, LU7, LU9, and bladder 65, 77.01 and 77.02. And stomach meridian affected 77.18. And large intestine meridian affected LU7, LU9, LI3, and 22.05 lingu. If there is a headache because of meningitis, 77.05, 06, and 07. And bleed 77.14 and needle 77.01. If headache because of brain tumor, 1010.03, that is the bladder 8, 1010.04, bladder 6, that treat bladder meridian, 77.05, GB39, 77.06, and 77.07, and 55.06, 77.01, and 77.02. Headache because of hydrocephalus, 77.01 and 55.06. And bleed around 77.07. These are the points. Okay. I think enough for today. Do you have any queries? Please ask on the group. Who is there? Dr. Shams is there. Dr. Shams, are you there? Now give me feedback how you like this session. Give me feedback. Who will talk? Savita Gaikwad. Savita Gaikwad, I'm going to unmute you. You are unmuted. Savita Gaikwad, you are unmuted. Please talk. Savita, are you there? Please raise your hand. Please raise your hand. You need to talk. Raise your hand. Aishwarya. Aishwarya, do you want to share feedback? Aishwarya, you are unmuted.
Hello.
Yes, Aishwarya.
हा सर मला पूर्ण नाही सेशन आज ऐकायला. हॅलो. आजचं सेशन पूर्ण नाही करता आलं पण ऐकलं तेवढं चांगलं होतं.
हिंदी में बोलो, हिंदी में बोलो.
हाँ एक्चुअली आज का पूरा सेक्शन में अटेंड नहीं कर पाई, लेकिन जो भी था वो अच्छा था. मुझे खुद को ज्यादा हेडेक रहता है हमेशा, तो उसके हिसाब से अभी सर ने जो पॉइंट्स दिए हैं मैं ट्राई करूंगी. सर और बीएल मेरिडियन पे लगाने कि क्लासिकल पे?
हाँ, कौन सा भी मेरिडियन में लगाओ, बीएल में लगाओ या क्लासिकल में लगाओ,
चलेगा ना. ओके.
हाँ हाँ.
या थैंक यू. बहुत दिनों के बाद सेशन हुआ है.
अच्छा अच्छा अच्छा. Okay. Isha Jawar, do you want to talk? Isha, share your feedback. Isha, you are unmuted.
Yes, sir.
You share your feedback.
फीडबैक तो बहुत सारे हैं सर, बहुत सारे पॉइंट्स आपने बताए अभी तक और बहुत सारी चीजों पर काम किया है और मेरे जो पेशेंट्स हैं उनको भी बहुत अच्छा उसमें फीडबैक मिला है. एक सिटिंग में, बेल्स पाल्सी में, हेडेक में, आई पेन में, सब चीजों में काफी अच्छा रहा है. थैंक यू सर, आपके गाइडेंस की वजह से हम लोग काफी कुछ कर पाते हैं.
Okay, welcome, welcome. Okay, thank you. Enough for today. Ending the session. Thank you very much.